Good afternoon, everyone. We are thrilled to have you here with us today. Before we dive in, let me ask you this. How confident are you in your ability to provide the best possible care for your patients, from diagnosis all the way through treatment? What if you could take your clinical practice to the next level with tools and strategies that maximize both efficiency and outcomes? Well, that's exactly what today's webinar is all about. My name is Myra Chen, your host and moderator, and on behalf of the entire eLotus team, I want to thank you for joining us today. For over 30 years, eLotus has been dedicated to bringing you the highest quality CEU content, featuring more than 200 expert speakers and 700 courses, covering over 3,000 hours of valuable learning. We are excited to continue that tradition with today's insightful topic, clinical excellence in patient care, from diagnosis to treatment. As a Taiwanese American who grew up in Texas, Dr. David Soul brings a unique perspective, blending the best of Eastern and Western medical practices. This powerful combination allows him to deliver outstanding patient care. With decades of experience treating numerous patients per day, Dr. Soul has developed highly efficient clinical protocols that help restore optimal health to his patients. At the core of Dr. Soul's success is a philosophy that resonates deeply. True healing and excellence in patient care must come from the heart. Today's webinar will give you the tools to elevate your own clinical practice and provide the best possible care for your patients. We are also excited to announce that Dr. Soul will be holding 2 additionally highly recommended courses with eLotus this year. Mark your calendars for April 25th, when Dr. Soul will present how you can effectively treat 20 plus patients in an hour with exceptional results, and also his next class on June 6th, where you'll dive into the Introduction to Bagua, Foundations for Health and Harmony. I'll post a link in the chat room to these courses and to the many other courses he also offers, including previous classes on digestion, detoxification, circulation, and more. And before we begin, a quick reminder. Please set your chat to everyone so that we can all engage in the conversation. And please feel free to ask any questions in the Q&A box during the presentation. And lastly, the quiz. The quiz for CEUs will be available by the next business day late afternoon for all attendees who meet the attendance requirements. Now, let's get started, and please join me in welcoming Dr. David Soul.
Good morning. Can everybody see me? Yes, fantastic. Happy Friday. It's gonna be yet another amazing fun day. But before we start, I want to give my heart to the people in California, the ones who are involved in the fire, or if you know someone who is in those fire, my heart goes out to you. But more importantly, those who may not be directly impacted by the fire, and you're in the region, one thing I do highly recommend is start doing things for prevention of the respiratory. Always think of the heart of the people that you are treating. And there are different protocols that you can use, of course, for the prevention, and focus on the energetic flow of the lung. And once it becomes symptomatic, especially if it's symptomatic, definitely use herbs for the prevention. But in the meantime, strengthen the lung. Strengthen the lung. I do treat patients based on the season as well, and based on what's going on. We're in New Mexico, so also we get fire from time to time, and the air quality can go down very quickly. And so I do things based on what's going on around you. And so this is very important. You want to make sure you're doing everything you can to maintain the highest level of health, not just managing symptoms. Go beyond that. Be the best that you can be. And so I want to thank Evergreen for providing me the opportunity and the eLotus, and definitely Myra for the very humbling introduction. Uh, I'm very fortunate and having that honor to serve and be able to share with you the people and the hearts that I've touched through the clinical practice in a clinical setting and what I have learned through the clinical experience. And truthfully, without those clinical experience, the book study is limitation to that. It's only theoretical. It's not practical. And unless you're doing research, even research, you have to factor in the practical aspects of it. But with the patient's care, patient care is definitely you have to be there in a practical sense. You have to care for them. You have to care for them. I do tell the staff ever since we opened the door, every person that walks in the door, you treat them like your own father, mother, brother, or sister, and nothing less. Nothing less. And you'll be amazed. That's when miracle occurs. Miracle occurs because your love for that person. And so this is very important. Come from the place of love, not just the theoretical components. So this is very important. And I'd like to thank Tina also and Dr. Chang and the whole family. They have a wonderful, wonderful family. And I look forward to meeting them. I'm going out to California later this month. And I'm really amazed and humbled by all the amazing people in our field of healthcare, of true healthcare, not sick care, but healthcare. And so today, the entire focus is on how can you give your best, your absolute best. And from the days of ER, one thing I truly realize is when you're working a day shift, plus they put you on a night shift, by the next morning, 4 o'clock in the morning, you've been up all day and all night. And even if I'm a patient, I don't want to see myself. You cannot give your absolute best. And so you have to know what your best is and constantly gauge your best for the person in front of you. Okay? The person in front of you. Not the person before that, because why? What the other person needs versus the person in front of you is going to be different. And how can you gauge it very quickly what they need? And so this is very important. There's a lot of preparation before the clinical, before the actual clinical contact with the patient. And what does that mean? And we'll get into all of that because you cannot give what you don't have. If you're not at your best, you cannot give beyond that. And that's the reality. So every second, every moment, you have to ask yourself, what is my best? And how can I be at my best? And so one thing that I like to share with you every year. So I start in Thanksgiving. So during Thanksgiving, what do? I give thanks for the giving, not for the receiving, because yes, a lot of people give thanks for the receiving. Thank you for giving me this. No, I thank for the ability to give. So I don't ask for more, I ask to do more with what I have. And when you start doing more will be given to you. And so this is very important to make sure that everything that you are doing, you're coming from the place of best. And that's how I start my year. And then between Thanksgiving and, of course, Christmas, Christmas it's a time of sharing. And what are you sharing? You're sharing love. And what's interesting is we all love Christmas, right? And one thing about Christmas is I love it so much, I make it every day of my life. Do you want to just have Christmas on Christmas Day or Christmas Eve, or do you want to have it every day? And I'm greedy. I want to have it every day. I want to share the love that I have. And when you have so much love, it's amazing. It's truly, truly amazing that you're able to share love every day of the year, but you have to learn how to cultivate the energy of love. And many of you, especially you've taken other classes, you know that I'm all about love and understanding how the love flows. So in love, that's where miracle occurs. In love, that's where miracle occurs. So we'll start that today. And so that's a place I love to be. Yes, if you don't know where that is, it is Hawaii, our 50th state. And we go there quite frequently because I'm an island boy. And I grew up in a Polynesian island. And yes, Taiwan indeed is a Polynesian island. And the ocean, because we're in the desert in New Mexico, a lot of sand, no ocean. And so we love to go to the ocean. And so we start planning for the following year because you cannot give what you don't have. And if you want to share love, you want to make sure that you have that love to share. And this is very important. If you don't have it, you can't share it. And so this is extremely important. I cannot emphasize that enough. It's not just what you do, but what you do based on how you feel. It's in the feeling. And you'll be amazed. The universe, God, or however you want to call it, how you can bring out the best in you. Okay, let's go to the slide. And yes, many of you probably know that by now. I don't like the A, B, C to Z's, right? All the titles. The title, what is serving is the ego. And do I want to serve the ego? Of course not. However, some people suggested to me, well, it gives you credential. I agree. By the state, by the school, by whatever, whoever. But at the end point, that credential may bring patient in, but the end point is not your credential. It's the result. It's the result, especially if you want the best type of marketing, and that is word of mouth. So to have that word of mouth is not what you do and your title, your degree, and none of that. It's really the hearts that you will be touching. And once you touch your heart, that's your best marketing is the word of mouth. And so for us, we're very fortunate. We literally hit the ground running. When we opened the clinic, the first week we had over 60 patients. By second week, the end of that first week, we had to do an expansion. The first weekend, we had to do an expansion of the rooms because we only had 4 rooms. Well, actually, take it back, 3 rooms. We only had 3 rooms at the time. We had to divide 2 walls to create 5 rooms. And one of them we use as a examining room. So we do the intake. And then by 3rd week, we hit 100 a week. And at that point, I was giving up my lunch. I was coming earlier. I was leaving later. I was like, oh, we need to do something else. And fortunately, and this is amazing, the universe really is guiding me the path. And that path, literally, our landlord would not let us rent. So there are 2 components in the clinic. You have the front part of the clinical rooms and the office and the welcoming area. Yes, it's not a waiting area, it's a welcoming area. Do you want people to come in and wait? No, I don't want them to wait. You want to welcome them. So that welcoming room, and also I have my office, and all this is in the front part. And the back part is actually a huge room. We call it the great room. And the landlord at first won't let us rent rent the front space without the back. So I asked the landlord, can I sublease the back part? Because it's a huge space. And the landlord said, yes, you can sublease it. And little did I know at the time that that room was prepared for us. It was prepared for us because we could have gone to a smaller space and not taking on that big space. And so we rented a space by end the first month. I talked to the staff, say, yeah, we need to move into that room. So we created the great room. You can call it community room. I think most people call it community rooms. And yes, we do have that great room. It's amazing space and that energy field in that space. And the position of the space, the magnetic field. So we can get into that also. There's a magnetic field of the earth. And of course, you want to either face south or north, but preferably south, right? So it's actually facing south. And we can talk about all of that. Some people call that feng shui. Yes, feng is wind, shui is water. So one is the flow of non-substantial, the other is the flow of substantial. So non-substantial and substantial. So yes, it's the yang and then the yin. And so it's all about the flow. It's all about the flow. The entire universe, not just healthcare, is hinged on one word, and that word is flow. And we'll get into the detail. And when there's no flow, of course, stagnation and pain. And so we'll get into more detail how to maintain flow and restore flow. And this is very important. And yes, my passion is life. And life, as I define it, is love in full emotion. Love in full emotion. So every step you take, everything you do, every word that you talk, that you speak, every thinking that you have, you want to make sure it's of love. And remember, the only way love can flow is from heart to heart. Love cannot flow any other way. However, in between, yes, there are other things like words, the sound, the needle you put in. There are action in between. But the end point is a feeling. The end point is the feeling. And really in life, it's not how much you accumulated or your status, your whatever. But really, end of life, what matters is how many hearts you have touched. And there's nothing more amazing than having the opportunity and the honor to serve and to touch hearts. And that's all I think about now, is how to touch hearts. So even as I'm speaking to you, what's the feeling I'm carrying? Is it the material? And no, that's of the thinking. That's not of the feeling. Is it the topic? No. Is it you? Yeah, maybe. Why do I say maybe? What do I think about? What I say and what you learn? Or what you're going to do with what you learn to touch the patient's heart, your patient's heart? That's what I'm thinking about. So that end point of the heart you'll be touching, I want to carry that feeling in my heart as we go through this process, even when I was creating the notes. Because I can go very theoretical and talk all about the scientific aspects of the treatment or the protocols or whatever you want to call it. This point does that, that point does that. Yes, we'll be covering some of that, but more importantly is the feeling. Whatever you do is a carrier of your feeling to deliver to the other side of the heart. So whatever you do, whether it's the needle, whether it's Tui-Na, whether it's the herb, is a carrier of the love that you have or not have to touch your heart on the other side. So that love in full emotion, I want to live my life to the fullest. And emotion, right? What does that mean? E means outward. It's outward motion, not inward. It's not about me. It's never about me. It'll never be about me. I came with nothing to this world. I will leave with nothing in this world. But the hearts that I've touched and the hearts you'll be touching and you are touching, that's what will carry on. And so this is very important. Without love, there's no healing. And the miracle I see, it's all because of love. Because of love. And really, people don't care how much you know until they know how much you care. And don't care from your head, care from your heart. Okay, and we'll keep it simple. The presentation outline. All those are talking points. And one thing you'll notice, the notes is just a reminder for me to talk about it. I don't go into that much detail, I write them. I'll draw graph, I'll do charts, I'll do different things as I explain them. Now, why is that important? Because for me, the talking points, it just gives me a topic to talk about, but it doesn't tell me the detail of what I'm going to talk about. And the detail of what I'm going to talk about, whether it's with a patient or with whoever it is based on the need of that individual, not on what I'm going to say. Not on what I'm going to say. It's based on the need of the individual. And so you have to gauge the heart of the patient. So in your exam room, and I tried different ways in the beginning. And yes, our upcoming class, the next one, is on how to treat that many patients. And for us, we did it out of necessity because of the word of mouth and everything that we did. And we reach close to 500 patients a week. And with one provider, me. How do you do that? And that's what we'll get into in the future, the next webinar. But in the meantime, through that process of growth, we have to be very efficient and effective. If you're efficient without effectiveness, are you able to produce a result? No. Meaning, if you compromise the effectiveness at the efficiency, then you'll get to a point that that growth will reverse itself. And so how do we do it? And is that possible? How is that possible? It is possible. And I'll share that with you. That effectiveness, that's what allows the clinics to grow. And in that growth, I have to create efficiency. We try to hire people, but one thing is we treat differently and the result is not the same. And so we're going to talk about how do you approach it so you can truly provide the effectiveness of your treatment. And so we're going to talk about that the next time. And one thing for me, and I'm very blessed because of it, is I'm able to see so many patients to gain the clinical experience. To gain the clinical experience. And if average acupuncture see, let's say 25 patients a week, and you're able to see 28 patients, 25 to 30, let's say 28 patients, and that's the maximum I've seen is 28 in an hour. In an hour. Imagine the clinical experience that you accumulate over a period of time. And so that means 1 hour versus someone's 1 week. And so I'm sharing with you from my own clinical experience on what works for me. And if it works for you, wonderful. And that's what I'm sharing with you based on my clinical experience. And behind it, I'll give you my theoretical understanding as to why it works, why it works. And I base all the treatments on the classical text. And then I try to use the finite understanding of the scientific method that I learned from medical school to try to understand it. And it's that combination. And so this is very important. The symptoms, and yes, we love abbreviations. In medical school, we have to write everything in abbreviation. My writing was a lot better before medical school. And then you have to write quickly. And now, sometimes I can't even read my own writing. I have to ask my wife, what did I write? And so This means symptoms. You have to gather the right symptoms. If you don't, I don't know if you ever got into a situation where you end up letting the patient talk about every single symptom they have from the beginning of their life to that point, including their grandkids. and before you know it, the time is an hour is done. Um, so how can you control that conversation, that efficiency? And what kind of question do you want to ask? And how do you ask the next question, the next question, next question, next question? So be not only precise, but concise. Precise and concise. You cannot get the right answer if you ask the wrong question. Remember that. You cannot get the right answer if you ask the wrong question. And so, yes, as you shall receive. If you ask the wrong question, you get the wrong answer. And so, how do you know what question to ask? To gather the symptoms. And so, the signs and symptoms, right? The SNS. So, this abbreviation that we use. And the signs and symptoms, we'll get into some of the physical exam. However, today's class will be more generalized, meaning I'm not getting into detail. We may talk about some cases here and there pertaining to whatever topic, right? But so it's important to know the general guideline first, and then in the future, we can cover, let's say, a topic specific to respiratory. How do you do physical exam? How do you do symptoms, gathering information? What kind of question do you want to think about and ask? And we'll get into more of that in more detail in the future classes or webinars. And so the symptom, always, you have to gather that information. But believe it or not, even before you contact with patient, it's very important. You absolutely have to prepare yourself to be your absolute best. And then after symptoms, of course, is the diagnose. And that diagnose, once you have that diagnose, this is what we're going to talk about the first part this morning. Not first part, this entire morning. So we'll talk about gathering the symptoms. We'll talk about the diagnose. And I have to control my time, otherwise I'll run out of time. There's so much to talk about. And then this afternoon, after the diagnose, you have to know how to treat and also write the herbal prescription or chemical prescription if you have that privilege. And then the endpoint, you have to know how to do the prognosis. And so we'll go through the process and then it becomes a loop. Every prognosis, it can take you to a different area, a different level. Some people call it peeling an onion layer by layer. True, I like to peel them faster because peeling an onion, when I'm cutting an onion, makes me cry. And the only tears I want to have is tears of joy. And so if you peel it slowly, it's too much agony. So what we want to do is, how can we make it faster? If someone can do it in 10 steps, how can I do it in 1 step? And I'll apply to the effective efficiency, which I'll cover next time. And I'll do a video next time actually of the tour of the clinic on how we set things up, how to create that efficiency. And that's crucial without compromising the effectiveness. And you would be thinking, well, that's conflicting, isn't it? If you want to connect with patients and touch your heart, then that means you have to spend the time in knowing them. True, yes, you do. Absolutely, you do. How can you see so many patients if you try to do that? As a paradox. No, it's not. And so this is important. How do you connect with patients? And that's why the work is before this, before you even come in contact with patients. And we'll get into that a little bit and maybe more next time. Okay. And so this is morning here and then afternoon here. And one thing I would like you to do, if you can, and to help me, to help you, to help me, to help you, is um, if you can type in what interests you, what class, what topic do you want to talk about? And I can, for the future classes, you can just type it in the three that interest you and that you want to learn more about. And I'll tell you, I don't know everything. And what I thought I knew, I later I realized I really didn't know. And like a medical doctor, you think you know a lot, but once you're in practice and once you start learning medicine beyond the chemically based medicine, then at that point you realize, wow, there's energetic, there's energetic. And how can I understand the energy? Well, and this is what I do with a lot of, when I do lectural classes, like I did not too long ago, I did a symposium, women's symposium, that's hosted by a medical school here. And one thing I challenge them, you have doctors, you have nurse practitioner, you have midwife. And one thing I challenge them is there any chemical reaction that can occur without exchange of energy? Ah, silence, right? Because they're focused on chemical reaction. We're focused on energy. So the ultimate point is actually the energy. When you increase the heat, you can drive the chemical reaction. When you increase the heat, you can drive the chemical reaction. When you increase the energy, and the reverse is also true. When you decrease the energy, what happens to the chemical reaction? Doesn't happen. So energy is crucial. Yes, it's energetic medicine. And what I love about the traditional medical text or classical medical text in Chinese medicine is even after thousands of years still valid. Why? It's based on observation. It's not based on scientific method. Scientific method changes based on their understanding in that moment. And so I love it because it stays true regardless. Sun's gonna come up every morning. There's 4 seasons or 5, however you want to divide it. It doesn't change. Winter's gonna be cold. Yes, it's freezing out there. And summer, unless you're in Hawaii, it's really nice there. That picture is taken during Christmas. We love going there. And so you want to start planning your best. You start planning your best for this upcoming year. And so we plan our rest and vacate. What is vacate? Is to empty. It's to empty. Meaning if you're taking a vacation, you're doing all kinds of stuff, and you come home, you're so tired. You have to take a vacation from your vacation. Well, that's not vacation. You're not vacating. And when we go there, we do absolutely nothing. Nothing. We just listen to the ocean, watch the ocean, watch the whale. This last time we saw whales from our lanai, our balcony. We're able to see it. It's amazing. And turtles, bunch of turtles. It's amazing. It just brings about that happiness, that joy in your heart. And how can we be one with nature, right? It's very important. And there's one concept, and I mention it again, and I'll mention it again and again and again and again throughout the entire day. And the word is flow. The word is flow. Nothing in the universe is constant in the physical world. Why? Because energy by nature wants to move. If you charge your battery on your phone and don't use it, and you come back, what happened to the charge? And that's exactly what I mean. Energy by nature wants to flow. And so can we capture energy? No. Momentarily. So the only constant in the universe, in the physical world, is change. And in that change, When you're changing in a way that is smooth, that's how we define the flow. So human body is the same. That flow is the same. You want to make sure you have that flow. One thing you'll notice in the slides, I include some of the slides that we have from previous for one reason, because it gives you continuity. I won't get into as much detail. I'll touch on it. So those of you who have not taken the other classes, please go back and view those videos so you can understand in more detail regarding sleep, regarding the nutrition, regarding the breathing, oxygen, regarding different aspects of health. And I like to have more topic specific. If you can type it in for me, and so I can prepare it. And based on my experience, I'll share my experience with you, what works for me and what doesn't work. And we'll go from there. Okay, so learning. There are 3 levels of learning. The lowest level is imitation. And that imitation, yes, you're following a protocol, which is good. It's an important starting point. When you follow that protocol, and if it works, great. If it doesn't work, you don't know what to do. And that's the lowest level of learning is imitation. Is imitating what works for someone else. The higher level is integrate. You start integrate what you're learning and try to understand as to why you're doing it the way you're doing it. And when it works, you say, I know it works because. And when it doesn't work, I know why it doesn't work. And this is how we're going to approach it. I want to teach you how to fish. I don't want to give you the fish. Imitation, I'm giving you the fish. I don't want to give you the fish. Let's teach you how to fish. So that integration. And once you're able to integrate, you go to a higher level, and that's innovation. You start to take what you learn and what people are doing and say, I can do it this way and make it even better. And you start seeing the possibilities. But there's one main requirement for the possibility to occur. And sometimes we call it miracles. And that is to be revealed later. Have fun with it. We're going to have a lot of fun today. So learning 2 words in Chinese, character on Mandarin is the 学 and 习. 习 is to put it into practice. Put it into practice. So 学 is the theoretical, it's the book learning, the classroom learning. So clinical learning is what we're going to focus on. I can get into theoretical, but I prefer not to, because it's a practical that we all want to know more about. And yes, always challenge your thinking and your learning by questioning, and learn how to ask the right question to get the right answer. And we talked about that. Okay. So next, you have to ask yourself, are you a healer or are you a doctor? Doctor, for me, that title became a status. And I don't want to have that so-called status. It turned me off when we had the white coat ceremony in medical school. And that was usually sometime first year of medical school. And for us, we did it towards the end of that first year. And it really turned me off because I saw a shift in some of my friends. And I remember one time, I thought he's a friend. And I know he had trouble with anatomy. He has difficulties, so I decided I'll spend a lot of time with you. I love anatomy. And so I did that. And I did well in anatomy. And so I spent a lot of time studying with him. And one time we were in the classroom in the stadium seating. He's sitting not directly in front of me, but to the side in front of me. And he was looking at some paper. And so I asked him, what is that? And quickly he folded them and he put it under the seats. He put it away. And so I thought he's a friend, so I Ask him afterwards. Oh, what's going on? And this is exactly what he told me. I'm here to give my MD, not to make friends. I'm here to give my MD, not to make friends. He's a doctor now. So for me, that really turned me off because there's an ego within that. And of course, not everybody. Not everybody's that way. I'd rather to be a healer. The healing. That's what we're doing this, is to heal. And that healing comes from the heart, not the mind. And make sure you have a caring heart. And all this we talked about. So really the question is, why do you want to be a healer? Why do you want to be a healer? Why do you want to share love? And in sharing that love, remember, you are the instrument for that flow. So if you have obstruction within yourself, flow doesn't occur. If you have obstruction with yourself, flow doesn't occur. So make sure that you are free of the obstruction. So you can yourself be the flow. Give you an example. When there's obstruction within the patient, right? And that's something that I would also like to do. Maybe we'll make a video when I go out to California on how to release one spot from another spot. Just use your hands, use your fingers to release from one spot from the another spot. And by doing that, what you're doing literally, you become the conduit for that flow. And so if there's obstruction within you, what happened to that conduit? That flow doesn't occur. And I can speak that from my own experience. When I'm not present meaning my heart, not just physically, but mentally, emotionally, and spiritually. When I'm truly present and I'm in that place of flow, that release it's amazing. And maybe we can do a video on that. Whether it's digestion, whether it's anything that is musculoskeletal. So it doesn't matter what it is, because you become the conduit. And if you cannot be the conduit, if you obstructed yourself and the patient is obstructed, it's a relaxing treatment. Okay, great. Go higher than that. Go higher than that. And so if you want to be the instrument of that flow, you have to make sure you have no obstruction. And how do you know you have no obstruction? One word. And this is where I want you to hold on to. Every time you're with a patient, without it, the treatment is subpar. It's not as good. And that word is peace. And peace, where's peace? In your head or in your heart? In your heart. When there's peace, love flows. When there's no peace, love cannot flow. If love doesn't flow, healing, not as good. And so if you want to be the highest level of healer, you have to make sure that you have no obstruction within you. Have you ever tried to love someone who is not in peace? You hug them and they're like, they don't hug you back. There's no flow. It's obstructed. But when you have peace, not only you can give love, but you can also receive love. Now, this is important. Receive. Receive. What does that mean? I'll get into more detail. Imagine you have all this knowledge that you learned from school. So think of a file cabinets, right? Every file cabinet, you have different files in there of knowledge. The question is, how do you know which file to pull out for the patient in front of you? I don't. And it's amazing. Some of the diagnose I'm pulling out of places that I don't even think about. That, oh, I learned that in medical school and I haven't seen it. But for this person, that's exactly what it is. So where did that come from? Where did that come from? Is it because of me? No, it's not because of me. Because my heart is open to the reception. Remember, a body is a transceiver. You can transmit and hopefully love, and receive and hopefully love. And yes, there are times you have to guard it because sometimes it's not love, don't take it. And so if there's any judgment, criticism, yeah, it's not mine. And so this is important to make sure that you're able to transceive, that transceiving of energy, right? So keep that in mind when we talk about patient contact, when you're with the patient, that initial contact with the patient. Are you able to transmit and receive the energy? You have to read the energy. Every single component of the physical, of the five senses, contains energy. That chair right there has energy. The TV has energy. So everything, that door has energy. So we're surrounded by energy. You are energy as well. And that energy is not just physical. A true energy is beyond physical. So it's not just electrical, but magnetic as well. And the feelings of a magnetic field. We cover that a little bit when we talk about optimal health. And this is one area a lot of people don't want to dive into. But you know what? That's the area that allowed me to be what I am today. And I'm very grateful for it. And that's why I want to share that with you. It's not just the knowledge itself, it's the heart behind that knowledge. It's a heart behind that knowledge. And I may not, if I didn't go through medical school and the Western component, I may not have that understanding. I saw what I didn't like, and now I know who I am and what I want to be and what allows me to be at my best. And every second, every day, I maintain my best. I maintain my best. Whether you're the first patient I see or last patient I see. It's not fair to a last patient if I'm not at my best. And I think that part we'll cover the next time. So flow. I talked about this before, but I was touching on it real quick. So if you look at the character and the translation of the character, without I won't go into too much detail. So it has to do with the movement, right? So the top part, 不通, tong, and tong is complete opposite. But if you look at the radicals, different radical, one is of the movement, the other is of disorder or disease. But this part is the same. So that part, what it means literally is the path and the use of the function. So yong is to use something or the function of whatever that is. And so you want to make sure you're able to establish the path so you can create the function or restore the function. And when the function is disease, that's tong. Yes, that's the fourth tone, right? Tong. Tong is the first tone. Tong. And so pronunciation is different. So that tong and tong becomes the polar opposite. So anytime there's pain, you have to think about flow. And anytime you think about flow, you have to think about pain. You have to develop that oppositional thinking. Oppositional thinking. Why? Because what you want to establish is the middle. The middle. And so you have to know where the middle is. All you see is the right. You want to ask, where's the left? Imagine you're driving on the road and all you see is one line on one side. How do you know where the middle is? You don't. It requires you to see both lines to stay in the middle. That's where it's the safest. So what we're doing is establishing the middle. Is establishing the middle. So can you have too much flow? Let's think of diarrhea. Is too much flow good? And not always. So to understand where the middle is. You don't want too much or too little. And so either one is helping us making adjustment to find the middle. So you have to find the middle, where the middle is. Okay, what's the time? 11:15. Okay, I have to watch the time. I can talk about it forever. Okay, so this is important. that opposite thinking, oppositional thinking. If you are a provider, if you want to bring the patient back to the middle, you have to know where the left is, where the right is, where the upper limit is, where the lower limit is to find the middle. And it's the middle is the safest. And so that's important. We'll get into more detail. So what is the force of the flow? And that force of flow in the Eastern perspective, yes, is yin yang qi xue, right? Yin yang qi xue, and also jin flow as much. So jin is more of your reserve. So yin yang qi and xue. So those four, right? And the understanding of yes, qi drives the blood, and so we'll you know the foundation. I won't get into the foundation. We'll go to the more advanced thinking. Okay, in the Western model, it's the fluid. And in that fluid, you have the blood, you have the lymph. So, and then also the two communication component. So if you have the nerve itself, right, the nerve is a chemical signal. It's the yang aspect of it. And the other control through the fluid is the hormonal. That's the yin component of it. So there's always yin and yang aspect to it. So there's the yin control, there's yang control. And so it's still the same thing. And that yin control, that fluid, within that fluid, that water is the key factor. That water is the key factor. You will hear me keep emphasizing the water because without the water, you cannot carry the nutrients throughout the body. You cannot carry out the toxin. And so that water is crucial. That's why you're over 70% water. Some people say 80%, and some people say 60%. And people are saying 60%, they don't drink enough water. So you want to drink more water. There's the importance of water, and you want to make sure the water and understand the role of water. The role of water, yes, is to carry stuff, to carry stuff. And when the body cannot carry stuff, then you get thirsty. Thirst is a result, it's not a cause. And so a lot of Western approach is based on the result, meaning the symptoms. They're treating the symptoms. Oh, you have pain. Let's kill the nerve. It's a bad news. Let's shoot the messenger. It doesn't make sense, does it? Temporarily fine. I mean, taking a pain pill. But you have to understand, well, what's the cause of it? What's the root cause of it? If you don't know the root cause, then of course you can never, ever address or restore the health. So this is important. You end up just managing symptoms. And please do not manage symptoms. Address the root cause.
Hey, Dr. So,
and so in the fluid, there's also blood and there's lymph, right? And understand the purpose of lymph. It's not physiology class. I won't get into detail. So understand
Jimmy,
the
you
lymphatic system, what it does, and how can you use that in your diagnosis when there's lymphadenopathy, when there's swollen lymph. What does that mean? And so, yes.
Our bandwidth is low.
Battery?
You're freezing low. You're freezing. Your internet is, the bandwidth is low. So you keep freezing and the screen is blurry.
Oh. Okay. That's, we can't do much on that, can we? Can they hear
close
me?
to the Wi-Fi? Well, what we can do, Dr. So, why don't we take a really quick break and then restart your computer, see any better?
Okay. All right. We will take a break.
Okay, let's take a break. We'll do a little diagnosing and we'll come back.